The
You know.
stories from the ER docs are like, pregnant people, uh, if we don't have to treat them, we're happier because we'd rather just push them off onto the maternity ward and let them take care of them because I would, what's the way to put it? I don't think pregnant people make ER docs nervous exactly, but there's always the whole pregnancy part of the equation that they'd be more comfortable if someone else dealt with. But they'll take care of you. But if
Yeah.
it's anything pregnancy related, they don't want to handle it. They just want
No.
someone else to take care of it.
Yeah, honestly, and you're right about that because I know people from talking online and they'll be telling me stuff and they're pregnant and they're like, "Where do I go?" And I'm just like, I'll tell you what, just go to labor and delivery. I don't care what it is. If an ambulance is not bringing you in and you are driving yourself, do not go to the ER. Just don't go there because first off, there it's going to take longer for you to get the care that you need because now they got to get you in and they got to do whatever and you don't know who's in there. So there's another thing. And so I can honestly tell you that, oh my gosh, I went to the ER when I was pregnant with Rainbow because I was getting sick so bad and I couldn't hold anything down. So I went into the ER. Basically, it was more to get checked out and to get an IV and whatever. But they treat you so differently. They're not very helpful. They don't really know very much when it comes to like having a baby. They're very, it's just not good. And I would hope like if anybody has like that problem where you need to go in, which that's what I was just going in. I got a couple IV bags. They couldn't really do anything. They gave me Zofran. They can't give you any meds for really anything. They can't do anything because that they don't know anything about it. And that's another thing with like an ambulance or anything. They cannot give you pain relief
Nope.
because you're pregnant. Like they can't do anything. So the emergency, like going into an emergency area of the hospital, that's exactly what it is. They can't give you anything. They can't do anything for you. I wish, but I was so out of it and I practically had to be carried in there. I wish I would have just got taken up to the labor and delivery of the hospital because I know they would have actually treated me better. I got wheeled into a little room where there was a bunch of people getting IVs and they basically put me in the back in the corner and just kind of left me and my at one point my bag was empty and I was just sitting there and I was just out of it, practically passed out in this chair. And there was another lady that was there and she's like, "How come they haven't come and talked to you or whatever?" And I was like, I don't know. And it was because I was pregnant. They didn't want to deal with me at all, so they just left me, maybe like whatever, but my bag was empty. And I was like, well, if they're not going to help me, they can at least send me home, like go get my mom, like, you know. I was like, I'm ready to leave. But another lady got like, there was two ladies, an older lady, another lady that was like younger. They started getting like really anxious because they were like, she's pregnant and nobody's coming back here. And I kept saying, I need a nurse. I need a nurse. I'm not like, I don't feel good, you know, whatever. And they just kept ignoring me. And finally, this one lady got up and she was like, she needs a nurse and she's pregnant. Like, you need to go over there right now. She's been waiting there. She got here before I did. And her bag is empty. You guys are not checking on her. And it was just this lady that was just, she was like mad. And sure enough, they came and whatever. Oh, well, I guess we can give you another one, you know, whatever. And they gave me another bag. And I was like, please don't leave me back here. Don't leave me, because the room would like fill up and empty out and fill up and empty out. And I was there for, I don't know how long I was there, but I was like, please don't leave me back in this room. The hospital by myself. It was like, and finally, they finally pulled me up, like, okay, you're going to be seen by the doctor. And the doctor was, I don't know if he was a resident doctor. I don't know. He was really nice. I'll give him this. He was really nice. He didn't know anything. And he told me that. He was like, look, I don't know about pregnancy. He's like, you're going to have to go see your doctor about this. We did give you a couple bags of, you know, like of this. We did do this. He's like, but we can't really do anything. And I think you should do this and try to do this. But he was like, if you're not eating and this is whatever, he's like, you're going to have to make some plans with your doctor because we can't help you. Like literally, that's what he said. He's like, we can help you. We can give you IVs. Like that's all I can do. He's like, but I can't help you. I can't do anything. And that was like, it was later on that I was like, I don't ever want to do that again. Like and I know other people that have experienced the same thing going into going in and getting bags, and they basically got kind of dumped because it's like nobody wants to touch the pregnant lady. Like, like everybody's scared of them. And so now knowing what I know, I would just go straight up to labor and delivery. Because even if I go up there and they just give me IVs and send me home, at least I'm in a place where they're going to actually treat me like a person.
Take care of
Like,
you.
they're
Well,
actually not going to leave me.
one of the things that hospitals have to deal with continuously, and it's the people using the ER as a doctor's office. And so by the time I left Children's, they had color-coded groups set up. And what it is if people brought their kids into the ER and they found out that they didn't have a primary care provider of any kind, not a family physician, not a GP, not a pediatrician, they would essentially enroll them in this group. And the group's job would be to find them a primary care provider for their child. So, I mean, one, because the ER is a terrible place to get medical care. It's a patch and release. It's all,
Yes.
and they just
Yes.
patch you up and send you out the door. And then they give the message to people who are like, hi, we've taken care of this problem, but if you do need additional care, we can't do that for you. You need to talk to your provider about it. If you don't have a provider, we will help you find a provider. And I thought, that's good. But they also don't want people to be sitting there walking into the ER thinking, I don't know if I could pay a doctor's bill, but at least if I go to the ER, I'm not going to get dinged. But it's like, ER care is not cheap. It's
No.
not efficient. It's the kind of thing that it's absolutely essential to have it available when you need it. But if you are using the ER as a primary care provider, we need to find a better solution for you.